Good.
Okay, thanks for joining us here this afternoon. We have Jerry Kayer, CEO of Lewis County Health System, is with us, and Ashley Waite, the Director of Public Health for Lewis County. Obviously, yesterday we announced our third positive case. At this point, we have tested 108 people in Lewis County, which is a great accomplishment. We are testing at a per capita rate that is on par with our peer communities throughout New York State. It's on par per capita with Jefferson and St. Lawrence County, so we are definitely getting our testing out there appropriately. But we want to make the point today that 3 confirmed cases is not necessarily reflective of the amount of spread this virus has in our community. So Ashley had mentioned Sunday that we want to assume community spread. And what we mean by that is that just because we only have 3 confirmed cases doesn't mean there aren't more cases throughout Lewis County. In fact, it's pretty safe to say there probably are more cases in Lewis County. So we've had a lot of people very concerned and wanting to know more about these 3 cases in particular, and that's good because it's important to identify the positives and isolate them. But the best way to stay safe and the best way to keep your family safe and your community safe is to assume that it's already here. Assume that it's already in your community, because it is. And so the strategies that we need to adopt for that are the social distancing, which we've talked about. Basically, it means that you need to stay home. If you don't have a reason, a necessary reason to go in public, you shouldn't. You can see us here today observing social distancing. This table's 12 feet wide, which means we've got about 6 feet between each of us. We also encourage hand washing. It's very important. And so one of the reasons why the 6 feet rule and the hand washing is so important is because the way this virus is spread is through droplets. And so I'm not even going to pretend to be a medical expert on that. We'll let Ashley explain why droplet protection is so important. So Ashley, can you talk about that a little bit?
Yes. So this virus is spread through droplets expelled from your respiratory symptoms. So those are expelled through coughing or sneezing. These droplets, if a person is within 6 feet of the infected person, can be breathed in to that person, then infecting them. These droplets are known to be fairly heavy, so they fall to surfaces. It is not clear exactly how long these surfaces or these viruses live on surfaces. Many factors, including temperature, what the surface is made of, will affect how long they live on the surface. But another way that a person could pick up the virus is by touching that infected surface and then touching their mouth, nose, or eyes.
So that's why you hear a lot of, don't touch your face, wash your hands, because that's how this virus is, as Ashley said, spread. So social distancing, hand washing, droplet protection, very important aspects that we want to reiterate to the community. We've heard a lot of feedback on people wanting more information on the positive cases. Well, where have they been? What social gatherings have they been to? What room are they in at the hospital? These types of things. You're not going to get that information from us, and there's a good reason for it. One is that it's not the government's job to tell the public people's private health information. We have very strong patient confidentiality laws in this country and in New York State, and Ashley and Jerry and their teams, they know how to protect the community from the spread of this virus, and we can do that without giving away everybody's individual confidential information. So we're not going to give out addresses, we're not going to give out known contacts. If you have been in contact with someone who tests positive and there is a likelihood that you may have been exposed, then you will be contacted by public health, because public health has a very detailed protocol for what is called contact tracing. And again, I'll allow Ashley to expand upon contact tracing, why that's important, and why it protects the public without us having to give out detailed confidential information.
So as soon as we have a positive case, we start what's called the case investigation. So we contact that individual or somebody that is able to speak for that individual in regard to when their symptoms started, their occupation, demographic information, and we go back 14 days to try and find the exposure to them. And then we also go 24 hours before the time that they started with symptoms until the time that we're interviewing them, and we gather a list of all of their contacts. This is a very in-depth process with lots of probing questions to ensure that we get all of the information that we need. Sometimes these investigations can take an entire day to track down all of the information that we need just to have our list. Once we have that list of contacts, we reach out to each one of them. And that's a phone call, that's ensuring that they know they then need to be quarantined. We go over what that means, make sure that they're able to quarantine, and have them sign quarantine orders. So that is our process, and that's how we prevent further spread of that virus.
Yep, absolutely. So to reiterate, we're not going to focus on, and we don't want the community to focus on every individual case. What the community needs to focus on are the big important things. You have to assume community spread, assume that it's already out there. Assume that when you go in public, the things that you touch and the people that you interact with could be carrying the virus. And so you have to take precautions like we talked about, social distancing, be within 6 feet, wash your hands, use hand sanitizer, use droplet protection, like wearing a mask. I think what we're hearing a lot in the community is, well, I've heard these cases are only in Lowville, so it's safe for me to go and visit my friends and hang out and go to public places in the town of Gray. Or, well, Harrisville's not infected right now, so I can go and visit down in Lyons Falls and do what I want because it's not here. That's not the case. It is here, okay? It's only that we've only found 3 positives through the testing. So the best way to protect yourselves is to follow that advice from public health. We want to thank today our corporate partners. Lewis County is so lucky to have such an amazing manufacturing core here. We have wonderful manufacturers here in Lewis County. We have Otis Technologies, which has already donated 500 little hand sanitizers like this. We've worked to distribute these out throughout the community, and today they donated an additional 200 hand sanitizers, same product, different packaging. So that's 700 hand sanitizing units that Otis has donated to the county in order to try to protect our community. So super kudos to Otis on that. Additionally, they have begun to manufacture these face shields. Okay, so these will be distributed to our EMS folks. We have 200 of these so far. Jerry, can you talk to the importance of these, this type of equipment and what you guys need at the hospital and what you have?
Yeah, so the glasses really are protecting the eyes, and then they supplement the mask. So if you don't have the traditional full face shield, this in combination with the mask is a good alternative and a reasonable alternative, particularly out in the field for the EMS providers.
Yeah, so wonderful contribution by Otis. We also have OmniFilter in Beaver Falls. They are manufacturing masks. They're working on a prototype. Very cool that they're stepping up. And Grand Slam, another wonderful manufacturer in Lewis County, again in Beaver Falls, they are producing a prototype for protective gowns. So just phenomenal that Lewis County is able to produce our own PPE to protect folks. And then of course we have our church groups and other community groups that are sewing masks for everybody. So outstanding work by our manufacturers and our community groups on producing PPE. It's not easy to get PPE right now. You've probably heard the governor every day talking about the need for more masks and more N95s and those types of things. So the fact that we can do that locally is a really wonderful thing. Hats off to our manufacturers. I want to touch on the Board of Legislator meeting will be held on Tuesday the 7th, first Tuesday of the month, just like we always do. It'll be 5 o'clock, just like we always do, except for this month, it'll be a conference call. So the legislators are going to call into a number. We'll allow the media to call in as well. That call will be recorded and posted online, and a transcript of that call will also be made available to the public. We won't, however, have the opportunity for everybody in the county to provide a public comment at the meeting. So if you want to provide a public comment for our April 7th board meeting, you have to send an email or make a phone call to the Board of Legislators office, Cassandra Mosier. She will take the comments, email or over the phone, and we will read those during the public comment period over the phone. Okay, so that's how we're handling public comment and public input for this one meeting. Not something that we would normally consider, but these are abnormal times. The last thing, I just want to highlight a couple numbers that are important for people to know. As you've probably heard, we have the volunteer program that has come out of our Strong Communities, Strong School initiative. We have school teachers and county employees that are available to help. Basically, anything that folks need when it comes to running errands, getting groceries, picking up pharmaceutical needs. We have a group of volunteers standing ready to help, and the number that you can call for that assistance is the DSS switchboard, which is 376-5400. So if you need a little help around your house, you need somebody to help go pick up groceries, you can call 376-5400. Someone will come to help you out. We also have been getting some phone calls regarding compliance with the governor's Pause New York order. So we're talking about the governor's executive orders, which talk about essential businesses versus non-essential businesses. Matilda's law with people encouraging folks that are elderly or immunocompromised to stay home. If you have questions or concerns about folks that may or may not be abiding by the governor's executive orders, which are laws, that is, his executive orders are laws, you can call the Sheriff's Department non-emergency number. Don't call 911. Call the non-emergency number, 376-3511. You will get someone from dispatch that'll help you out, but don't call the emergency number. Call the sheriff at 376-3511. The last thing we want to plug is Ashley's team has been doing wonderful Facebook Live reports Monday, Wednesday, and Friday at 4 o'clock. We've highlighted all kinds of things happening in the community. Next week they've got the Chamber of Commerce on deck. I know they're working with our employment and training folks to do a session on unemployment and some of the challenges that the New York State Department of Labor is having. So great information coming out from the Facebook Live sessions. You have to go to the Lewis County Public Health Facebook page Monday, Wednesday, and Friday at 4 o'clock. You can follow along live. You can type in your own questions and have Ashley and her team answer those. So that's what we have today. Jerry and Ashley might have some additional comments, or we can take questions.
I don't have any right now.
Right. And just a couple of thoughts. A couple of partners that I'd like to thank. The Fort Drum Regional Health Planning Organization had delivered bottled water and a number of snacks and treats for our nurse clinical team on medical, surgical, and ICU in support of their work in, as you know, treating patients who were recently positive and admitted. So thank you, and shout outs to Fort Drum Regional Health Planning Organization. And a shout out to all our community members who have been dropping off cloth masks at the hospital. And what we're doing with those are actually running them through a hot water sterilizing process to make sure that they're clean, to validate Ryan's point COVID is in the community, and so we want to make sure products we're bringing in are appropriately sanitized, and then they will be packaged and set aside and used if our internal stock gets to critical low levels. So we're going to be very judicious and appropriate in our utilization of these masks. But thank you to all the community members who are thinking of us and bringing these forward. Recently, Dr. Atul Gawande, a physician of national prominence, was speaking on television and said the two most important things that we can do are screenings to include temperature taking and social distancing. And Lewis County was very early in adopting these two measures, and our local health system began temperature taking before anyone else was talking about it at these larger institutional levels. And I share that because we continue to screen every single person who enters the organization, asked questions about travel, and asked about how they're feeling, and then taking a temperature. We have had to send now about a dozen people to see their provider and their health provider because they were showing a fever. So the screening is working, and we're going to continue it for the foreseeable future. It is a little bit disruptive to the flow of foot traffic in and out of the health system, but we appreciate everyone's understanding and what we are trying to do. In fact, the health system and the buildings of the health system are probably some of the safest buildings in our community because of the screening, because of the temperature taking, because of the availability of masks, because of the availability of hand sanitizers. So we are truly at a very good position there. And the reason I mention this is we still have to be able to provide the typical health care that people need. Blood draws, the images out of radiology, PTOT, access to the primary care physicians, not for frivolous visits, but for visits that will help people maintain their health now so that they don't crash 1 month, 2 months, 3 months from now. And so, I want to convey that we are open. We are not doing elective surgeries at the directive and request of the governor for the obvious reasons of burning through the PPE, personal protective equipment, faster. But basic visits to primary care and the other diagnostic services are appropriate. We have implemented social distancing approaches within the health system along with the screenings. And to support easier access to the lab, we are evaluating a mobile trailer to be set up outside just to make it easier for the public to continue with their lab work. More to come on that, but I would expect very shortly that will be an option that will be available to our community. So keep in mind, we are very active in screening, we are doing deep cleaning consistently, and we are disinfecting consistently. So we really are a safe place. Unnecessary public are not coming. So employees, patients, and community members in need of health care can be seen safely, efficiently, and effectively. I also would like to reflect on what occurred yesterday, and I was able to give the Board of Managers, Ryan and Ashley, an update on this as well late yesterday. The governor and the commissioner of the Department of Health requested a PPE, ventilator, clinical loan inventory of all New York State hospitals. And I sort of agree with the governor's language on we need to think of New York State as one large health system where we have the ability to support and help each other. And I say that with a little bit of angst, but I think philosophically we need to truly approach this as what can we do to help to prevent the spread of the virus any further, and make sure that curve gets bent. So we had to provide a complete inventory of all of our personal protective equipment. Our team at the hospital has done a wonderful job beginning about 6 weeks ago, because there were the early indications of bringing material on board, and we have delivery dates for the foreseeable future of the shields, the gowns, the gloves, the mask. So we've provided our inventory and future delivery schedule to the department and to the governor. We have also provided a full inventory of our ventilators and associated parts that support those ventilators, and the ability to splice some of those ventilators so we can increase our capacity to serve people. And we also provided a list of clinical personnel who would be part of the loan program. And that's really an inventory of physicians, nurses, and other technologists who may have an interest in assisting those in New York City who are really dealing with an event that we really can't appreciate here in northern New York. And we have had some individuals volunteer to bring their name forward as part of that pool who would cycle through supporting the health effort in New York City. In addition, we were asked, would we have any capacity to receive COVID patients in our community? And when you look at all of the maps, and when you look at where individuals who are testing positive, there is a clear line. Essentially, it's I-90 to 87 down towards New York greater metropolitan region. So we do have some capacity. So I filled out the inventory accurately. Will individuals from downstate be sent to Lewis County? I can't say. Every hospital was expected to answer the survey honestly and accurately. And with the incentive, if you don't, then your operating license is at risk. I take that with a grain of salt, because every CEO I've met is committed to not only serving their community, but our region, and really wants, and they all want to be part of putting an end to this virus in our state. So that's what's happening from the hospital perspective, and I just want to commend our clinical teams, the doctors, the nurses, the lab technicians, and all of the support staff, environmental services, dietary, for how they have responded over these last 6 weeks. It's inspirational, and everyone has stepped up, and I think appreciating the seriousness and also the fact that we are an important community resource that we need to keep safe.
Okay, do you have any questions?
Okay, well, Nick Altmeyer with linkinglewiscounty.com. I guess we're the only media here today. So first, I'll just open by saying really appreciate you guys doing these press availabilities. I know, at least from our audience's standpoint, they've been very well received. People really like the local flavor that you guys are giving, and just giving them local information, what's going on here in the community and what they can expect and things like that. So really appreciate you guys taking the time to do that, and now is probably a good time to let people know that you have agreed to do these a couple times a week. So obviously, if breaking news happens outside of those periods, you're still going to reach out to us for that, but just a couple times a week, just to do a session like this where you can just update the community what's going on. So I think that's great, and we really appreciate that. So being that we're the only member of the media here, I guess I can cruise through my questions pretty quickly here. I guess we'll start with a question we've been getting a lot, you've been getting a lot, you kind of addressed it already. I know when you said, you're not going to get down to specific addresses and things like that with the patients that have tested positive. And I know the message for the community is assume everybody has it. And not only have we heard that here locally, we hear that at the national level and the state level. So no matter where you go, assume everybody has it. But I do understand people's concerns. Sometimes it is a little reassuring to them to know, was it in my town, was it not in my town? So I guess the question is, without giving out specific addresses, which we didn't ask for before, we asked for like a geographic location or something like that. Other counties, every county seems to be handling it differently. So I was just wondering if you could speak to what the discrepancy is with that. Like, people are seeing in St. Lawrence County, they're kind of releasing their data by town, and they have a lot of similar sized towns that we do. They're saying, you know, one case in Hammond, one case in Stockholm. You know, these are small rural towns as well. So can you just address why there's such a discrepancy from county to county?
So I can't speak for what other counties are doing. I can speak for what I believe is right. We are a small community, a rural community. Everybody knows each other here in Lewis County, and I feel strongly that everybody is entitled to have their health information properly protected, and I don't want to risk breaching that at all. So that is why we have not released that level of information. We also only have a few cases right now, so that further increases the chance of identifying somebody. It's different if there's multiple cases, and you know, that would decrease the risk of identifying somebody.
Nick, I could also add something. And I'm going to bring out my inner Dr. Faust. Okay? If we are practicing social distancing, it really doesn't matter. Okay? And two, we all read a book in high school, probably freshman or sophomore year, The Scarlet A. All right? And when especially in rural communities with low population density, when people are identified with the Scarlet A, bad things happen. Irrational fears take over communities. So there is, in addition to protecting people's health status, which is required by law, we also don't want to incite irrational behaviors, which is, it can happen. So if we are practicing social distancing, it really doesn't matter. Individuals are being treated appropriately, both in hospital and out of hospital, and the system that public health has put in place is outstanding. And I from all that I've learned about our local system, our community is really very fortunate in being well served.
Okay. All right. Is there any way, and again, I understand the point and everything like that. I think it's just hard for some people to understand, like, you know, if you said northern half of the county, southern half of the county, you're really not, you're not hurting anyone's personal information or personal data. You know, and as far as, like, you know, a gathering that people are at or things like that, I understand not wanting to disclose a gathering, things like that. One question similar to that did come up, though, is are you guys asking, so you know, if somebody does test positive, are you asking them, you know, have you been to Walmart recently, have you been to Tops recently, things like that? And would you notify the public that on, you know, April 1st at 8 p.m. these two people were in Walmart, just as a heads up? So is that something you would do? Absolutely.
So we track every place that they've been, every contact that they've had that they know. Obviously, if you've been to a store, you don't know who you've been in contact with. But a press release would be put out that there was a positive case at a store at a certain time. And then we would ask individuals who were potentially exposed to contact us if they were there at the same time, and then we would quarantine from there.
Okay.
Can I add to that?
Sure.
Nick? So to tie what Jerry and Ashley have both said together, yes, you know, of course we're going to do that contact tracing and let people know what areas, especially a public place like that, may have been exposed. However, even if you were in Walmart at, you know, 8 p.m. last Tuesday at the same time as this person, if you were practicing social distancing, if you were washing your hands, and if you went home and wiped down your groceries and did the right thing and took care of yourselves and your family the way we're talking about, then you're not going to be a contact and you're not going to be at risk. So those things are important, and we are going to do our due diligence, but they're not nearly as important, not even close to as important as everybody taking personal responsibility and doing the right thing and following the advice that you're hearing from experts locally You know, Ashley's our friend and neighbor. She's not the commissioner of health, but she is an expert in this. And you're hearing it from the state level and their commissioner of health. And you're hearing it from the federal level with Dr. Fauci and their commissioner of health. This is scientifically proven to work. So people need to take it seriously. And if you are doing those things, then, you know, this contact tracing and worrying about each individual case is going to matter much, much less.
Okay.
And I would also add, on Saturday, Ryan and I had the opportunity to, I guess, be part of and watch the contact tracing process. It is a remarkable process, incredible detail, and incredible research. It's really quite remarkable, and as a result, very effective.
Perfect.
And I have to also say that our community has done a good job to date. Our contact lists have been minimal, which is wonderful. That's what we want. Somebody who has not taken this seriously, our contact tracing would be far more extensive.
Okay. And just the last few things on the positive cases. Is there any way, can you confirm or not, if the third case is related to the other two cases?
It is not.
Okay. Is there any travel history or anything like that with the third case?
There was an exposure outside of the county that was identified.
Okay. And as far as like patient condition for all three patients, is there any way you can talk about are they requiring ICU treatment at this time, or standard care, or is that going too deep? People are just curious of, you know.
I'll let Jerry speak to the hospitalized patients, but we do have one in home isolation.
Okay. And the two in the hospital?
So as you can imagine, I'm going to say HIPAA does not allow me to give you any additional details. And on top of that, in our small community, very quickly people would be able to figure out who, so I really can't go there.
Okay. I guess another question is, things change on a daily basis, as we're all aware of, and as our emails and conference calls are filled up every day. You had mentioned earlier when you were talking about people coughing and sneezing is the main way that this spreads, and I guess there's been some additional evidence produced today that was given to the White House as far as simple talking and breathing and things like that. They're thinking that it can spread that way. Now, I know that there's no like rules or anything like that people have to wear masks when they go outside, but would that be your recommendation? And we're not talking like a surgical mask or things that would impede the healthcare system, but the mask like that people are making and the homemade mask and things like that. If you need to get out to the grocery store or the pharmacy, is that a recommendation on your behalf?
We have certainly recommended that for the higher risk individuals, the elderly, the
We mean everybody.
It's an extra precaution that could absolutely be taken.
Okay. Some of the things that people have brought up as well are, and Ryan kind of touched on that Lewis County and especially Lavelle is home to some larger manufacturing industries and things like that. Obviously, not everybody that works there is coming from within our county. So can you just explain the process a little bit? If somebody did test positive from one of those large work locations, but they lived in Jefferson County, Oneida County, somewhere else, would your office be notified of that, and would you do the contact tracing through wherever the employment location was?
Yes. Any other county that this individual lived in would contact us, because we are responsible for contact tracing within our own county. So they would notify us that there was a positive case and give us as much detail as possible so we could follow up with the company to do the appropriate contact tracing of anybody who is Lewis County, and if they weren't Lewis County, we would pass those names along to the appropriate county for their quarantine order follow-up, because
Okay.
that is, the quarantine orders is by where they live.
Okay. And obviously you're the Director of Public Health for Lewis County, but just would like to ask you, is it concerning to you when you see some of the higher number of cases in neighboring counties, say St. Lawrence County, for example? We're starting to see a climb there. I think Oneida County's got quite a few at this point too. Is that concerning to you as a neighboring county, or does it change your strategy any at all?
It really doesn't change my strategy at all. At this point, I think, we all need to assume that it's here and we need to take proper precautions. We are fully ready for a full response in regard to identifying our positive cases and doing the investigations and contact tracing. So as far as extra concern with growing number, obviously this is a scary situation for everybody, so I am concerned for our residents, just because I feel their anxiety, and I want them to rest assured that we are doing everything we can to keep our residents safe.
Okay, thank
Nick,
you.
I might add that, concern is a relative term. New York City concerns me, Albany, Rochester, Buffalo. North of I-90, we have some cases, but when you look at the state map and you look at the density of those cases, I'm not concerned because, one, I believe it's in our community, not fully detected. Two, we have an infrastructure in place and a sound collaborative approach between different parts of Lewis County government, dealing and talking almost daily. We are prepared, so it isn't so much a concern like I feel for those places that are just being hit hard, not by 3 cases or 14 cases or 30 cases, but thousands of cases. So I think that's why it always comes back to social distancing, washing your hands, protecting yourself. And if we continue to do that, we will mitigate the spread. And even though there's been a bump up in St. Lawrence County, the fact remains they've mitigated the spread. They have a little tiny cluster here or there, but they are doing good work there just like they are in Jefferson County. So I think concern for me isn't really the right word. It's about constant preparedness and collaborative work, so as these cases do appear, we're actively working together.
Okay, perfect.
Yeah, one thing that the governor has said consistently is, New York City is a glimpse into the future, right? So the Midwest, every place else that feels a little isolated right now, you can look at New York and know what might come your way. Same is kind of true as this moves north a little bit, but we have an extraordinary opportunity in Lewis County because, one, we are ahead of the curve. It's here, yes, but we are ahead of the curve. Two, we already have low population density. We're not right on top of each other in apartment buildings, in bodegas, like they are in New York City and other large cities. So we have that opportunity, but we can't squander it by pretending that everything's going to be okay because we're Lewis County and we're isolated. We're not. We have some advantages, structural advantages, like Jerry was talking about, but we're not isolated.
Right.
And we have an opportunity to protect ourselves by doing the right thing now. And if we do that, then we really can, survive this and do quite well. But we need everybody to take it seriously. Everybody in the community needs to be a good neighbor. Think about your elderly neighbors. Think about your neighbors that may be sick or unwell. Think about how your actions and the things that you're choosing to do could impact them. And that's how we're going to protect our community.
Okay, thank you. The next couple questions were for Mr. Kayer. You kind of touched on it when you were speaking earlier. One of the questions I had for you was the governor's announcement for maybe some upstate physicians and staff helping out in New York City. Has any request actually been made to your organization? And I know you said you had some people that were actually interested in volunteering. So would that be kind of right off the bat, or is that kind of a work in progress?
I think it's a work in progress. The first part of the process was this comprehensive inventory tool that we had to complete in truly a matter of hours. We had to verify that it was accurate and had to submit it by 2 o'clock yesterday afternoon. Last I heard, and this is about 3 hours old, the pool of individuals available to go to New York City is at 80,000. So on a practical level, if any of the individuals who are volunteering from our local organization are called, it's probably a few weeks away. It's possible, but it won't happen immediately. There are some screenings and coordination and those kinds of things that have to be in place. But now there's this cadre of health professionals, 80,000 deep, ready to give some relief to the New York City hospitals.
Okay.
Okay.
And you also mentioned that it's important for people to know that the hospital is still open for normal everyday services and things like that. I was just curious and I think some people have been asking as well, are any of the providers starting to lean more on like telemedicine and things like that through your organization? Have you seen like an uptick in that, or is it still better to have people directly come in?
We have seen an uptick in telemedicine, and we have an electronic medical record. Our vendor is an organization called the Meditech, and we will be elevating our telemedicine capacity within the next 2 weeks as we implement what we call a new module into the electronic medical record. Aside from that, we have some scattered and selective use of some of the current technologies like FaceTime and those kinds of things that you can do some limited work in. However, for us to get to that next level that has all the built-in security measures that need to occur when you're doing telemedicine, we're probably, I would say, 2, maybe 3 weeks out from being able to do it at a deeper level. So that's helpful as well.
Mm-hmm.
Telemedicine, I think, is an effective tool if you don't have that immediate crisis, and I can't think of, and you have a rash, it's bothering you. That's very helpful. But there are some things that you still need to see the doctor for.
Right.
But it is a tool. I think at this point, the other thing we've been working on from a telemedicine point of view, and this is really to support our staff, is telepsych through our EAP provider. And I can't speak for the other county departments, but our staff have been living, COVID-19 every hour of every day, and now we've treated some patients, and you can see that stress is starting to build, the anxiety is starting to build, the concern is starting to build. So to be able to help folks decompress and internalize and rationalize and cope with this, we are working hard to make sure that the telepsych is available.
All right, thank you. And Ryan, you had mentioned with some of the local manufacturers and some of the things that they're doing, are there efforts strictly for local, like the hospital and local places here, or are they kind of reaching out beyond that, do you know?
No, what they're making, the capacity that they have, I believe that the 200 that they've made, these are the first 200 off the line, and they're right here for us. Same is true with the masks and gowns that are being made over in Beaver Falls. They're not rolling off the assembly lines yet.
Right.
But when they do, I think we will have first dibs. But I hope they're able to sell them, far and wide. It's not a crime to make money even in a crisis. They're doing their community service and hopefully able to make a little profit. And I think that's a great thing that our employers can be nimble and good corporate citizens, and also protect their bottom line. So that's great.
For sure. Okay. And I guess the last question is, and you kind of touched on it a little bit in your opening, Ryan, as far as the testing. I think we're up over 100 tests performed now, which we talked about when we look at other regions of the country, other regions of the world. Per capita, it's right on par with a lot of places like that. But are you still comfortable with where testing is at nationally? I'm not saying what you guys are like willing to do, but what you're capable of doing. So are you able to get the results back fast enough and things like that? Have you noticed any more of a streamlined process with that?
We have seen results come in faster, I would say over the last week.
as we start seeing some of the newer tests come out, I mean, we've
Yeah.
heard things about like the 2-hour test and things like that. Will they be available to like small locations like this, or are they kind of more for the hardcore frontline places? Or maybe you don't know.
There's been other tests that have been available, but to date we don't have any guidance from the New York State Department of Health for any other testing at this point.
Okay.
I think we can say, these guys are the public health experts, but I think we can pretty well say that if we had the ability to test as many people as possible, we would.
Right.
We don't. We only have a limited number of testing kits. That's why we only test people who have symptoms and we have reason to believe might be positive. Is that right, Ashley?
Yes.
Yeah. So, are we doing fine with testing? Yes. Would it be great to be able to test everybody? Of course. But, we only have a limited number of resources to test swabs and kits. And so we're using them judiciously and appropriately.
Mm-hmm.
So I can add to that as well. I think our lab director is working aggressively to bring in the reagents for the analyzer that we have now that would be able to test on site the COVID for the COVID-19 virus. So the key is being able to get those reagents, and if we do, then we're looking at a 2 to 4, maybe 6 hour turnaround time, real time, which would be an incredible support to public health and whether or not somebody needs to be quarantined, So I don't think, you saw the president, I think earlier this week or late last week, pull out a product called Abbott. That's not coming to our region anytime soon.
Okay.
So I think if we can continue to drive to get these reagents so that we can test locally, that is our best shot, and that's where we're putting our energy.
Okay. And so just so people understand, right now when you do a test, it gets sent away to a lab outside of the area. I don't know if you're still using Wadsworth or not, but probably somewhere downstate.
We're using a couple of different labs,
Right.
but mainly LabCorp.
So the ability to do on-site testing, obviously, as Mr. Kayer was saying, gives you a huge time advantage when you're working on
absolutely.
things
Well,
like that.
you can accurately say it's a game changer
Right.
to be able to test locally.
Right. Perfect. And I guess the last topic on testing is, there's been a lot of talk about the serology test where they can go back and find out, maybe if you've had it. I know we're talking probably a few weeks down the road, but is that something you would like to implement here and something that you would work on here as far as like finding out if people have the antibodies and things like that?
Once I have New York State Department of Health guidance, yes, that is something that we would work on, but currently there is no guidance to do that testing, and who that testing would be appropriate for, exactly what that's ruling out. It's a different test than what we're currently doing, so there needs to be clear guidance on when it's appropriate to use that, and we do not have that to date, but it is something I'm certainly open to.
Okay. I think that kind of wraps up my questions for today. We got to save some for Tuesday, so.
Maybe we won't have to do one.
But just as a final thought, I know if you guys want to give a final message or anything, but I know the main message for people to take away is if you don't need to be out, stay at home.
Yes.
Yeah, that's what we talked about last, on Sunday as well. Right now, being a good neighbor means staying at home. Your actions today affect all of your friends, your family, and your neighbors, and it's a small price to pay to be a little more responsible, a little more respectful over the next month or so, however long this lasts, than worrying, about protecting the health of your friends and neighbors and family. So be responsible, be respectful, listen to Ashley, listen to Jerry, and we'll all get through this in no time.
And the best thing to do when you're out and about is, just go with the presumption that you have the virus and everyone around you has the virus. So the best way, well, I guess if everybody had it, then we wouldn't need to be protecting ourselves from it. But basically what they were saying is assume everybody has it. So in order to protect
so keeping
yourself.
your 6 feet away from other people.
Exactly.
Yes.
Perfect. Thanks, guys. Appreciate your time today.